unearthed.
And joining us right now, healthcare expert Nick Tate, New York Times bestselling author of the Obamacare Survival Guide. And Nick, these comments getting a lot of play. Are they really going to have any effect, though, on maybe reforming Obamacare?
I think they give the GOP the opportunity to really move forward. I mean, they really are lighting a fire underneath what is already a movement to change this law. The question, though, is what's the GOP going to do now that they control both the House and Senate? Are we going to get more repeal votes that will clearly go nowhere to repeal Obamacare, you know, root and branch, as Mitch McConnell says? The president will clearly veto those laws. I suspect we'll get at least one of those in the new Congress to allow the new members to get on the record in voting to repeal Obamacare. But then I'm hoping that Republicans will buckle down and get to work on the real practical changes they can make right now.
All right, let's talk about some of those practical changes. What can they take on? Individual mandate, you hear about that. Medical devices tax. What are you predicting is going to happen?
Well, you know, predicting the future is always a tricky business. But I do think there are three things they could immediately go after. Okay. One, the medical device manufacturing tax. They could repeal it outright. They've made some independent changes over the course of this law that have allowed them to do precisely that. It would save a couple $2 billion. The second thing they can do is they can modify the employer mandate that requires employers of a certain size to provide health benefits to their workers or pay a tax. They could raise the standards so that only people working 40 hours a week would be required to be covered, or they could delay it, they could defund it, or they could move away from the mandate and provide tax breaks and tax benefits to companies that provide health benefits. The third thing I think they could do is they could modify the Medicaid standards. Individual states are trying a variety of reforms and experiments, going toward Medicaid HMOs in Florida, going toward private Medicaid in Arkansas, charging very low premiums and copays in Illinois. These states want to move forward with Medicaid reform, but this law has had kind of a wet blanket on those efforts, and the Republicans could clear the way that would both save money and actually protect people in those states who need it.
Now, Nick, I also want to talk about the skyrocketing price of generic medications. I mean, this is very important. It affects all of us. What can we do about it, and why are we seeing this?
Well, market forces, there's a new report in the New England Journal of Medicine that says that some generic drugs have just gone up by profound amounts. Antibiotics are up 5,000 times what they were a year ago. The number is that 10% of generics have doubled in price over just the last year. Some of it is lack of competition. Some of it is some other changes in the marketplace. The other thing is that a lot of imports of generics from places like India have been banned because of safety problems. So really the take-home message for consumers is talk to your doctors about whether your generic is actually saving you money. Is a brand name option a better choice for you right now? It's safety and it's financing as well. I mean, at this point, what we're seeing with this new report is not only you paying more for your generic, but you may not be getting even what you're paying for in that case.
You mentioned antibiotics. I know a lot of companies, Walmart and so forth, they don't even charge for those, or at least they haven't. I don't know. Are we seeing a change in that?
Well, as a savvy consumer, you should be looking at those options. Antibiotics in particular, you can pick them up for, you know, $4 a month, or in some places they're free. Walmart, Target, even grocery stores and retail clinics. So the truth is that with all the changes that are happening with Obamacare, with healthcare, you really need to become a savvy consumer. You need to figure out the best way to use your healthcare dollar. Shop around just as you would for shoes or clothes or food. You need to take the same approach with healthcare, with medicine, with doctors.
And going back to Obamacare, I heard this morning that the uninsured people, that the penalty for that now is going to triple.
Well, if you don't have insurance, in fact, the rate goes up from 1% of your income next year to 2.5% of your income. So it will, in fact, increase. So if you don't have insurance, you're going to pay more for it in terms of the fine to the federal government. What we still don't know is how they're going to enforce that. We're waiting to see the tax forms and how effectively they'll do that.
Yeah, I think a lot of people thought with the Republicans gaining control of both the House and the Senate that there would be a repeal of the individual mandate. It doesn't look like that's going to happen, and anything that's done, Nick, is going to be kind of around the edges. It doesn't look like it's going to be a total repeal of the Affordable Care Act.
It's true. I mean, we've heard the whole idea is to fix it, not nix it, or amend it, you know, not end it. But I think that you can make some substantive changes that are more than just kind of nibbling around the edges. Seems to me like the employer mandate is here, or the individual mandate is here to stay, at least until we may have a Republican in the White House in 2017. But for now, I think people need to be prepared to have insurance, or they're going to get socked in their taxes in some way.
How much of an issue do you think this will be moving forward, especially in the presidential election? Because, I mean, all the candidates lining up on the right seem like they want to repeal Obamacare. It looks like the prospective Democratic candidate, Hillary Clinton, obviously she's been fighting for health care since the mid-90s. What are your thoughts as far as this being kind of a political hot potato in the years to come?
Obamacare, in many ways, is the kind of political issue that just continues to have legs. I don't think it's going to go away I think it's going to be, just as it was a key driver in the 2012 election, clearly a key driver in these last midterm elections in terms of getting voters out. I think it's also going to drive what happens in the presidential campaign. And, you know, make no mistake, it's not just the Republicans who have something at stake here, it's the Democrats as well. I hope and I believe that there are political pressures that will push the moderates in both parties together in both branches to say, look, there are aspects of this law that people frankly like, covering people with pre-existing conditions, making sure your kids can stay on your health insurance to age 26. Some benefits for seniors that were sweeteners that were introduced early on. There's about 11 million people who are getting benefits now that did not have them before. Some of them are going to feel like if Obamacare is repealed, those have been taken away. And who are they going to blame? The Republicans. So there's some dangers there for Republicans. But Democrats also are going to need to make some changes so they can go to the voters in 2 years and say, look, these were things that didn't work. The employer mandate, the high cost for health care, the medical device tax, Medicaid. These are things that we have worked to fix. And the question is, in this next 2 years, are we going to see a Congress and a White House that is more likely to work together on these issues, or are they just going to continue to fight? And I think it could be a key issue as we head into the election
and
for
I
president.
think it could be interesting, too, to see what happens in some of these governors' offices with the Medicaid expansion. I mean, John Kasich, he won in Ohio supporting the Medicaid expansion. Then you have a guy like Charlie Crist who won, and he was not accepting those Medicaid dollars. So I think there's a lot of battles still ahead in Obamacare. And Nick Tate, thanks so much for joining us this morning, kind of
My
going
pleasure.
over some of the issues as far as that's concerned. And so we've got obviously a lot more to talk about right here on America's Forum. So thanks for joining us.